How to insert a nasogastric tube. Learn the essential steps for safely and effectively inserting a nasogastric (NG) tube, a crucial procedure for feeding and medication administration. For definitive verification, especially before feeding, consider an X-ray. Secure the tube with adhesive tape on the nose and cheek to prevent displacement. Monitor for complications such as coughing, gagging, or respiratory distress. Finally, document the procedure including tube size, nostril used, insertion depth, confirmation method, and patient response. Proper technique and patient care during NG tube insertion are essential to minimize discomfort and avoid complications. Thank you for watching this video. We hope you found this guide helpful for understanding the nasogastric tube insertion process.